everybody. This is Dr. Forth, and today's topic is actually about hip and low back pain. There's probably going to be several in this series because low back pain in particular can be caused by multiple different factors. But today, we're actually going to be looking at a couple of muscles that commonly cause discomfort in both of those areas. So I'm talking about the psoas muscle and the tensor fasciae lata muscle. I was trying actually to make a drawing to illustrate where these are found, and it was so appallingly bad that I'm not going to show it on the video. Guess we all know why I didn't go to art school. But you can do a search online and find pictures of these. So if you want to look at that, that'll help you get an idea of where they're located. Psoas muscle actually connects, it's deep inside the abdomen and it connects to the front of the low back bones and it goes down through the pelvis and connects to the inside of the hip. And its main job is uh, actually bending the leg at the hip and also bringing the leg closer to the midline. The other muscle we're going to talk about is tensor fasciae lata, but let's go over psoas first. So like I said, it connects to the bones in the low back and also the discs. So now we can have problems with the muscle being weak or extra tight. Either one of those can create problems. So one of the ways that it gets to be an issue is improper abdominal exercises, particularly the ones where you see people lifting their legs up, like they're laying down or even hanging up and lifting their legs. If the abs are weak, you're going to really be putting a lot of stress and activity into that psoas muscle because what does it do? It causes the hip joint to flex, right? And so doing those exercises a lot can actually irritate that psoas muscle. I like the exercise ball for ab exercises, and it's a very humbling experience if you've ever done it. When I talk about exercise ball, I'm not talking about the smaller weighted balls. I'm talking about the inflatable ones that you sit or lay on to do exercises. Now, the correct size exercise ball is the one that when you're seated on it, your feet are flat on the floor and your knees and hips are flexed to 90 degrees. So every one that I've seen actually comes with videos and or sheets of exercises. And you can even look up some good exercises, videos to do for ab work. I really feel like the exercise ball isolates the abs much more effectively. And so that would help to eliminate the irritation of the psoas caused by ab exercises. Another thing that can cause problem is if you're sitting for long periods of time, like maybe you have a computer job or another type of work where you are sitting for a long period of time, this can actually cause weakening and shortening of those muscles. Now, if one side is tighter than the other, it can create kind of a curvature in the low back area. And that can also cause hip pain, or the person may have trouble standing upright, particularly after long periods of time sitting, might have trouble getting into an upright standing posture. If it's tight on both sides, this can create what's known as a hyperlordosis or a sway back position. And this sway back position creates bad mechanics where we shift the weight bearing of the body from the big heavy part of the backbone to the little tiny joint parts at the back. And that can actually refer pain across the buttock area and back area. And sometimes people think that they have a sciatic problem, but it's not actually irritation of the sciatic nerve. It's because of improper body mechanics where you have that sway back position, putting more stress on those joints in the low back. You can have pain in the hip joint or snapping sensation in the hip with movement, and that's because this psoas muscle actually connects to the inside of the hip joint. So we can do some stretches to help relieve that tightness and discomfort. There are a couple of different ones. First one is kind of like a kneeling lunge. So you're going to kneel on both knees, and then you want to sit up so that your lower legs and knees are on the floor, but you're not resting your buttocks on your feet. You're going to straighten up so that you're kind of in an upright kneeling position. And then you lift one foot and put it in front of the knee, and you're going to kind of shift your weight forward towards that forward facing knee. Now make sure that when you do this motion, you have your foot far enough out in front that when you shift forward, your knee doesn't go ahead of your foot. You should feel the stretch across the hip on the side where the knee is still on the ground. And make sure that you don't arch your back when you do this motion. You should just feel a good stretch across the front of the hip. Another one is you lay on a bench or on the bed and you scoot over to the edge and kind of drop one leg off the bench or the bed, and you pull the other leg that's closer to the middle of the bed or the bench. You pull that up towards your chest. And again, it should be a nice stretch across the hip and maybe the top of the leg. None of these stretch activities should be painful. So if it's painful, stop. That's obviously not the right exercise for you. And if you have any kind of hip problem, you might want to consult with your provider before you do that. The other muscle that we were talking about that can be a perpetrator of hip and back pain is called the tensor fasciae latae muscle. And this muscle actually connects to the big bone of the pelvis, and then it's really pretty short. It just goes down as far as the hip joint where your leg starts to bend at the hip. After that point, the muscle fibers connect to a fibrous band that goes down the outside of the thigh and connects at the outside just below the knee. Now, very often runners complain of discomfort. That's actually called the IT band, okay? That fibrous band that runs down the outside of the leg. So the tensor fasciae latae, relatively short muscle, it connects to that long fibrous band, and that's the IT band. So this muscle can be tight in runners, and they particularly might notice pain when they're going down the hill. So the muscle is connecting to that band and it attaches on the outside of the knee. The muscle can also contribute to hip pain or snapping feeling on the outside of the hip. This can be a difficult one to isolate for stretches. There are some stretches that are purported to stretch this, but they really stretch like gluteus medius muscle and so forth. But one good way to isolate this one for stretch, you're going to stand upright against a wall. So your feet can be a few inches away from the wall, but your upper back is going to be against the wall. And you're going to tilt your pelvis to flatten out your low back. Now, if this muscle is tight, you might really have a challenge doing that. And so you only want to go to the point that it's comfortable, but you feel a bit of a stretch. Just like the other one, it's not useful to cause yourself pain. The stretches should not be painful. And if they are, you might need to reevaluate and stop doing that stretch. No protocol for working with these situations is complete without a functional assessment, really. So it's good if you have a professional, maybe your personal trainer or your provider that can help you assess and figure out which muscles need work. We don't really stretch without also strengthening the muscles that need to be strengthened. The literature shows that just stretching muscles and not doing anything to strengthen the other muscles, it's not as effective. So make sure that you look into that. Manual therapy like massage or trigger point is really great for both of these muscles.